Doug Ellis.
Thanks, Doug.
Commissioners, you are live whenever you're ready.
All right, perfect. Thank you. Okay, it's 10 a.m. Let's go ahead and get started. I believe everybody is here. We will go ahead and open this meeting with public comment on any subject not on the agenda and that commissioners have jurisdiction over. Is there any public comment?
No, can you let us know who is on the phone, please?
Yep, I think Mike, Wynn, Doug Ellis. That is all. Is anyone else on the phone? Okay.
Thank you.
Any public comment, Nicole?
No, sir.
Okay. I guess we'll get going. On the way of announcements, just received a message from Teresa, says public health nurse, stating that we currently have 52 cases, and a little advisory that she gave us. She says currently Broadwater County is experiencing community spread of COVID-19. We have exceeded our staff capacity to manage daily contact tracing. At this time, we will be limiting our calls to contacts to those who are high risk or immunocompromised. Providers can help by telling each person who comes in for testing and self-identifies as a contact to quarantine for 14 days after the date of last exposure to the case. I've also asked Doug Ellis to join us, and at the end of the meeting, he'll give us an update on elections. We do have some claims to pay, and I believe that was posted on the website. Claims are in the amount of $127,092. Is there a motion?
I'll make a motion to pay the claims and set amount.
I'm not going to second.
Okay. I will second the motion to pay the claims in the amount of $127,092.04. Is there any discussion? Okay, hearing none. All those in favor signify by saying aye. Aye.
Aye.
Okay, motion carries. Thank you.
Please record for the minutes I am abstaining.
Okay, next on the agenda is the independent contract agreement with Billings Clinic to provide detention nurse services. Wynn?
Yes, Darrell. Good morning. I know Nick put out an RFP in regards to the jail nurse position. The only one that came back was from Billings Clinic. Nick's not in today, nor is Brandon, so I don't have the exact number of what it is. But that's the only one that we have that's come back. So I believe it's for 15 hours a week. And I think it's kind of doing the same thing that we've been doing with, I believe her name is Linda, who's been here since Karen left, as kind of a contract service. So I think it's just basically continuing the same thing that we're doing now. So.
Okay. And I see that is for $29 an hour. You probably know more than I did. Nick did not leave me with with the contracts. I haven't got to see it. No. Okay. Yeah, and the schedule is the nurse will be available from 15 to 20 hours a week.
Yeah. And she's been doing a real good job, Daryl. I mean, she's been here very punctually. She seems getting everything done that needs to be done. So I've been very happy with her. So.
Okay. Is there any other discussion?
No, sir.
I'll move that we sign the contract. I think anytime we can partner, everybody wins.
I'll second the motion.
All right, very good. Motion is made and seconded to sign the contract with Billings Clinic to provide detention nurse services. And would be for 15 to 20 hours a week at a rate of $29 an hour. Is there any discussion? Any discussion? Okay, hearing none. All those in favor signify by saying aye.
Aye.
Motion carries. Now, when is that going to be signed by us, or is that signed by you?
I don't know how that's set up yet. So I guess, like I said, I was hoping Nick was going to leave me a copy of it. I haven't got to see it yet. But if it is need to be signed by you guys, I'll bring it over and make arrangements somehow. I'm not sure when everybody's going to come back, but
Yep.
we'll. If it needs to be signed by me, what I'll do is I'll just, if it needs to be signed by me, then I will sign it and scan it over so you guys have a copy of it as well. And do you want me to send that to Ann as well then? If
Send it what?
What's that?
Say that again. Say that again.
Do you want me, if it just needs my signature on it, do you want me to sign it and then scan it over to you guys and to Ann as well?
Yes, yeah. That would be great.
And then if it needs your signature, Daryl, then I'll just bring it over and leave it in Michelle's office and then go from there.
Okay.
Okay?
All right, sounds good. Thank you, Win.
Thank you.
Yeah, I guess as long as we have you, let's go ahead and skip ahead just a little bit. We have the CRS, inmate excess medical insurance agreement.
Yes, sir.
And you said you would like to continue the inmate excess medical insurance, which costs 91 cents per day per inmate. And you'd also like to add the optional security and guardian coverage, which costs 6 cents per inmate per day.
Yes, if we could. I looked at some of the other ones that are there. I don't know if everybody has that agreement in front of them right now. One of the things on there, obviously, is the pregnancy one, but we don't see enough. I don't think we see enough female detainees that would be under our care to justify doing that. It's very rare in many occasions. But with that security and guarding, and I don't know if everybody's been able to look at, because some of it's been fairly new, we had that one inmate that we spent about 12 days sitting on at the hospital, St. Pete's. They got an infection, so we had to do 24-hour-a-day coverage on him for, I think it was 12 or 14 days. It was a very long period of time. And then we just had one here a few weeks back, young man with some addiction issues, had a stroke in the jail. He was also on, it was over the weekend, he was on felony charges, and so we ended up taking him to St. Pete's, sitting on him all weekend and then into the week, and come to find out he ended up getting life-flighted over to Billings, and so we actually ultimately dismissed that charge until he could get healthy in his medical condition, and we'll see if we want to entertain charging him again. But that would be, for 6 cents a day, I think that's a pretty appropriate thing if we can get some sort of reimbursement back for those times where we do have inmates that are under our control as pretrial detainees that end up going to the hospital, and we have to sit on them for a long period of time. And I think that's with the amount of, as once combined, 10,000 medical is met, and that's per inmate per year. If we put somebody in a hospital, that $10,000 is visualized very quickly in regards to their medical treatment. So I think that by the end of the first day, we'd probably be in an appropriate spot to where we'd start getting reimbursed for some of that security and guarding cost.
Okay. All right, sounds good. Any more discussion?
Daryl, this is Laura. I think it's important to make sure that people know that this is not for all the inmates in the detention center. This is just for Broadwater County citizens in the detention center. Anyone housed there from another county has that option from that county. We do not pay for them. So somebody coming in from Carbon County, for example, Carbon County pays the excess inmate insurance or any other insurance, not us, not Broadwater County citizens.
All right, good. Thanks for clarifying that. Thank you.
And in regards to that, Daryl, just so we have an idea where we're at today, currently as we sit on a Monday morning, we have 10 of our own inmates in our facility. So that would apply to those 10, and that's it. So exactly what Laura was saying, just for Broadwater County arrests and pretrial detainees, not for Lewis and Clark or anybody else. So.
All right, perfect. All right, is there any more discussion? Okay. Hearing none, is there a motion to accept this agreement?
I'll make a motion to accept the agreement.
I'll second that motion.
Okay, a motion is made and seconded to accept the inmate access medical agreement, 91 cents per day per inmate for the medical, and 6 cents per day for security and guarding. All those in favor signify by saying aye.
Aye.
Motion carries. All right, next, Nicole will make the presentation for the recommendation of our on-call engineer.
Good morning. Can you hear me okay?
Yes, we can. Thank you.
Okay. So our engineer selection committee met, and we reviewed the engineer submittals. We received 5 of them. We then turned it into in-person interviews. We interviewed 2 engineers, potential engineers. And after conducting these interviews in careful consideration and deliberation, the selection committee would like to recommend to the commissioners that they award the contract for on-call engineering services to Great West Engineering.
Okay. Is there any discussion? Yeah, Daryl, this is Mike. Go ahead, Laura.
I just have a question for, just to let the citizens know, who was on the review committee?
Oh, yes, definitely. I'm sorry. So there was myself, Nicole Brown, Mike Myers, Daryl Folkford, Mike Delger, Al Christofferson, and Josh Obert.
And you guys met once to review the applications and then for interviews of 3 of the applicants, is that correct?
It was initially, so the first part of that is correct, yes. We did meet in person to go over each of the 5 submittals, and then we whittled it down to 3 based on qualifications. We then set up the in-person interviews, and one of the engineers selected for interviews declined an interview because they did not feel that they could meet the floodplain manager portion of our request. So we ended up interviewing only 2.
Okay, thank you very much.
You're welcome.
Oh, Nicole?
Yes, ma'am.
Never mind.
Okay.
Thanks.
Mike, did you have a comment?
Yeah, I'd like to thank all of the people that Nicole listed for doing an excellent job as far as going through the applications and both and the interviews and reviews. I think everybody did an exceptional job. It wasn't really that easy of a choice until we did the interviews. But I'd like to thank those department heads for helping out.
Yeah, you're right, Mike. Thank you. It was a great process, and so any more discussion? Okay. With that, is there a motion to accept Great West Engineering as our on-call engineer?
I'll make a motion to approve Great West Engineering as the on-call engineer.
I'll second the motion.
Okay. Motion is made and seconded to accept Great West Engineering as our on-call engineer. All those in favor signify by saying aye.
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 Aye. Okay, the motion carries. Thank you, everybody. Doug, are you online?
I am.
All right. I know that we received from you this weekend saying that elections are going to move. So if you could go ahead and fill us in on what the plan is and let the public know what to expect.
Yeah. As right now, the school has decided that would be too many people going through the school. I agree with them. So our election will be same time, 7 a.m. to 8 a.m. At the 4-H building out at the fairgrounds. I currently have about 9 election judges scheduled to work that day, so we're still a little short on them. I've got a couple that I'm waiting to hear back from, but we've got about 6 that we might be having another quick school so we can get enough to even keep that polling place open. So the way it looks right now is everything is good for the fairgrounds. We're getting quite a few absentee ballots coming in, so that's still an option. People can, after 5 o'clock today, will be the close of late registration. So after 5 today, they will have to get their ballot here at the courthouse, and we will no longer be mailing ballots out to people.
Okay. All right, good. I guess as far as if you think that you're still going to need some help with the election judges, I mean, let's get the word out as soon as we can into the paper and on all the different listservs and websites so that we can get some volunteers to help you. Okay.
Yeah, we will need. I'd like to have 4 or 5 people at least to be cleaning the booths and the machines. Not sure that they specifically have to be trained as election judges. We just need people to clean. I think if I get 4 more election judges, we should be able to to hold the election without too much of a delay to anyone.
All right, sounds good. And are you still planning to have a outside poll for those who cannot wear a mask?
Yeah, I'm not sure how that 4-H building is. If they've got a little room off to the side, we might set that up. If not, we'll have to have it outside.
Okay. Yeah, maybe like the kitchen area or something like that. Maybe you could designate as a separate area. I don't know. Just a suggestion.
Yeah, well, I'll go out there this week and take a look at it and see if there's a better option than standing outside.
Okay. All right. Perfect. Any questions from anybody else? Oh. Okay, good. Thanks, Doug, for joining us.
Okay, you bet. Thank you.
Thanks, Doug. All right. Let's see, I have one more administrative thing that we need to take care of, and that is I sent a letter to everyone 2 weeks ago for us to send to Sharon Walker to inform her that we're not going to automatically renew our concessionaire agreement. I'd like to have that signed and sent out, please.
Daryl, because that letter and the intent requires action, it needs to be put on the agenda so that we can go ahead and have it advertised for the public, have a discussion, and then decide as a team how we're going to move forward. So we can't just sign a letter. We have to have it agended, noticed, published, and go through the public process.
Okay, I'll do that. Anything else?
Daryl, this is Mike. I saw that email this morning about Hill County not paying into the airport fund.
Yes.
What's the situation with that thing?
So I forward that on to Corey. Corey is going to contact their county attorney, then find out really what the situation is, if it's something that they have overlooked or if they're actually refusing to make that payment, and then we will go from there.
Okay,
but,
thank you.
It is. It's something. It's important for us to get that money returned to us so that we can complete our own project that's coming up here in 2023.
Yep. Okay. Thank you very much.
Yep. Anything else?
I don't have anything. No.
Nope.
Okay. Very good. So what's your guys' feelings for next Monday? Are you ready to have a normal commission meeting based on our protocols that we've put in place?
I'm hoping to.
Okay. I guess I would like you to start that process again.
Is that the only change you're proposing at this time? Courthouse stays the same until we get our numbers down?
Yeah. I mean, the courthouse will stay the same, but as far as for our actual public commission meeting, I would like to go ahead and open that back to the public, but still keep it just to people that are on the agenda.
Then 6 feet apart for sitting. The chairs don't look.
Yes.
They look like they might be a little bit closer than that. So we might have to do a little bit of tweaking so that we can keep people safe until we get this under control.
Yeah, I think we can do that. Okay. Well, that's what we'll plan on then for next Monday. Anything else, anybody?
No.
Okay, then I guess we stand adjourned. Thanks, everybody.
Thank you.
Thank you, Helen.
Thanks,
Nicole.
Helen. Bye.
Thanks, everyone.